when people decide I'm going to come to therapy. Typically it's because they have hit some sort of stressor or there was a last straw sort of situation where they really do. It's just almost like an emotional and mental wall. Like, oh my goodness, out of nowhere I'm having breakdowns at work, or out of nowhere I lost my mind because my husband didn't pick his socks up for the 400th time. When the stress sort of hits a fever pitch, is typically where people end up in our office. There's such a hesitancy about, mental health. I think a lot of it is cultural. A lot of thinking, and it's not specific to the Midwest, although it's a common thing here. I don't know that it's a regional issue. I think it's, oh, I can handle it by myself. A lot of people keep things within the family. That sort of issue tends to happen. But you also have to think about mental health as a field in general. The field has changed rapidly over the last 50 or 60 years. Prior to this, you were crazy to see a therapist, and we really just didn't know enough. And I think now the coming generations are not nearly as ill-informed as prior to, and I don't feel that they're smarter than their parents or anything of that nature. I think it's just a cultural shift of educating yourself on understanding, hey, this will affect very literally every aspect of your life if allowed to, or if unmanaged. It can absolutely cause some pretty detrimental things. You meet people who have had relationship problems their entire life, or just don't speak to a parent, etc., which could have been, maybe there was something that we could have done, maybe not, but maybe there was something that we could have done, maybe there was an intervention that could have been done 10 years ago that could have prevented a lot of this. So I think it really is just a lack of awareness, maybe a lack of education, maybe some shift in cultural bias, like we see a lot of things sort of begin to evolve, the later on in life we are, what were we doing 100 years ago compared to now? It might just take a few sessions, a month or two. Some of the easier stuff maybe, or some of the less difficult things, or I have attention deficit disorder and just want to learn how to adjust my schedule a little bit. Perfect. That might be a shorter term thing. But I have that conversation with people a lot, particularly when they come in to process trauma. This will take longer than you want it to. You're going to have to put work in, and it's probably going to get worse before it gets better. Doesn't sound like great news, I know. But if you do not take those steps to inform and to work with somebody, the worst thing that you could do would be to quit in the middle of the process. You've made so much progress, even though it wasn't linear. I think that that's another issue to bring up, is progress is not linear. I think people sometimes get discouraged, when it looks more like a wave rather than a straight line. But that's part of it. It will get worse because things are into the forefront of your mind. It could possibly get better right away and then maybe tail off and then have to, work its way back. All of these things are 100% to be expected.